Afghanistan and Pakistan. I've had your colleagues from Cairo and from where was the other one from? My goodness, West Africa. I'm trying to get a grip on what the pandemic looks like in the third world. What is your reporting on Pakistan and Afghanistan and the pandemic?
hmm Well, what aid organizations are warning now is that they expect the number of infections to rapidly increase in the coming weeks. So right now in Afghanistan, the number of confirmed cases is just over 480, I believe, according to data from yesterday. But that is expected to rapidly increase. Officials believe that the actual number is probably much higher because testing has been so limited. Afghanistan's only carried out over 3,000 tests, and that's for an estimated population of over 30 million.
Have there been reports from their medical system, such as it is, and I really don't know, and I'd love for you to explain to me the Afghani and Pakistani medical systems. Have there been reports of surges into the ICU and respiratory illnesses, such as would be associated with a COVID outbreak?
Well, so Afghanistan and Pakistan are not near kind of the peak of the curve, as how other countries have described it that we're seeing in the United States right now, for example. So they haven't experienced those surges yet. But the concern is that these are two countries that are much less equipped to deal with those surges once they arrive. Afghanistan and Pakistan both have very low access to health care for their populations. They've got large percentage of their populations that live below the poverty line, high cases of malnutrition. So the worry is that when this surge does come in the next few weeks, it will completely overwhelm their medical systems.
In the 1918 to 1920 pandemic, as related by John Barry in The Great Influenza, most of the third world fatalities were never even recorded, Susannah, George, because there was no public health agency to actually compile the statistics. Will that be the case in Afghanistan and Pakistan?
Both countries are trying to ramp up their ability to respond to this virus. They've got a lot of support from outside, from the United Nations and other aid organizations. But if you look at how much testing they've done, that is a good indicator of how they would probably be able to respond to any sort of upswing in infection rates. And the testing has been so incredibly limited that if things stay the way they are, then they will not be able to respond to high levels of infection. But both countries are trying to ramp up their abilities in that area.
Later on the program, I'm going to have on former SEAL Dan Crenshaw, now member of Congress, who was wounded in Afghanistan and was taken care of by American medicine in the golden hour and in the transfer. I have no idea what Afghan medicine is like. Have you ever used it, Susannah, George, or do you rely upon American medicine delivered through the embassy and the military?
The healthcare system in Afghanistan is incredibly limited. Many people outside of the big cities have a hard time accessing healthcare. For people who live inside Taliban-controlled territory, their nearest hospital is usually inside government-controlled territory. So civilians would need to cross these kind of front lines between Taliban troops and Afghan government troops in order to reach healthcare. So that's one of the other things that people are very concerned about in Afghanistan, especially, is that if there isn't a ceasefire or if violence levels don't come down, that violence could make in access to healthcare even worse, because it could make it impossible for people to cross those front lines in order to get to a hospital.
Tell me about Pakistan. Of course, the great British legacy in most of their former colonies, including India and Pakistan, is an emphasis on medicine. There is a great tradition of Pakistani medicine which extends into the United States. Are their systems light years ahead of those in Afghanistan? Do they have capacity for any kind of a surge in COVID?
The capacity that Pakistan has, that Afghanistan doesn't have, is they have some private hospitals that are actually quite good. But those are only accessible to the wealthy in Pakistan. And that's not the segment of the country that people are most worried about being hard hit by a potential coronavirus outbreak. Pakistan has some very densely populated cities that are mostly inhabited by poor people. And it's the poor segment of the population that people are most concerned about with the potential coronavirus outbreak, and those people don't have access to these nicer hospitals that exist in Pakistan.
So in my conversations with Sudarshan Raghavan, Danielle Paquette, and now you, Susannah George, I've been trying to look for indications that there is a worldwide wave breaking. And I haven't heard it yet from any of you three, only the worry. What do you think will tell us that it's arrived in the way that, you're in a shuttered London? Boris Johnson is recovering. He's not out of the woods, but he's in a recovery unit as opposed to ICU. That's good. London is shuttered. I'm in D.C., which is shuttered. Have those countries that you cover shut down, and what are you looking for early indications of the pandemic in either Afghanistan or Pakistan?
Afghanistan and Pakistan both have different levels of kind of lockdowns. Kabul is locked down. Non-essential businesses are shuttered. In Pakistan, it's kind of province by province. So parts of, Islamabad is locked down, and other parts of the city, other parts of the country. What people are looking for is, they're looking to the data in the same way that other people are looking other parts of the world. They're trying to ramp up that testing, but what they're really, the data that we'll be able to see more easily will be hospital admissions. And, it's not complete because not everyone has access to hospital care, but it'll definitely be an indication of where the countries are in relation to that kind of curve of infection.
Are you staying in London for the duration, or will you be heading back?
Oh, I hope to be heading back next week.
Yeah, it's pretty remarkable. In a nutshell, what's your career been?
Oh, well, I covered mainly the Middle East before joining the Washington Post and covering Afghanistan, Pakistan. I covered Iraq for many years and just kind of finished up there about 2 years ago, and when I was with the Associated Press. And then
do you know my friend John Burns?
Oh, yes, I do.
I'll go down to Oxford before you leave and tell him I said hello. I hope you will join us again, Susannah, when you are back in Kabul or wherever you are headed next, and stay safe. And I appreciate your taking the time to join me this morning from London.
Thank you so much for having me on.